quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. I just wanted to spend a moment talking about this affair at the VA hospitals. There was a woman, Phyllis Hollenbeck, who's a physician that was a whistleblower that started the investigation about care at the VA. She quit after she saw the workload and that the hospitals did not have enough doctors, resulting in nurses handling cases that were too complex for them. And there were many complaints from veterans about delayed care. The Dr. Hollenbeck said it was unethical to put us in that position, said of the overstressed staff. She said, your heart gets broken. Well, what were they doing? Schemes to disguise wait times generally followed a handful of approaches. In Phoenix, administrators were overwhelmed by new patients, so many veterans were not logged in the waiting list. So it made it easy to hide delays in providing care if the patients weren't put in the waiting list. Another strategy was for the Veterans Hospital employees to record the first date a doctor was available as the desired date requested by the veteran, even if they wanted an earlier date. And one employee at the VA in Cheyenne, Wyoming said, yeah, it was gaming the system. In Jackson, Dr. Hollenbeck reported that hospital administrators created ghost clinics in which veterans were assigned to non-existent clinics to make it appear that they were receiving timely care. And in Albuquerque, an employee at the Veterans Hospital said some doctors were shocked when they received a memo a few months ago stating that 20% of physician performance pay would be doled out to doctors who found a way to limit follow-up visits by patients to 2 a year. A tactic, and I'm quoting in the paper, this is all from the New York Times, it's not my words, a tactic to reduce waiting times by persuading veterans to make fewer appointments. And again, quote unquote, clinic staff were instructed to enter false data into veterans' charts because it would improve the data about clinic availability. That's what this commotion's about. We promise that we will see you within one day. If you're a veteran or others, give us a call at 212-CHOICES. That's the beauty of a private cancer center treating cancer patients. You have a doctor, not a student, not a resident. You have a doctor who takes care of you and is responsive to you. The doctor will give you their cell phone number. You can call day or night. You can get care. You can get access when you want without limitation. And another big article that was in the Wall Street Journal this week actually looked at another strategy to limit the care you're getting for cancer care. And it's a front page article in the Wall Street Journal stating, this is an article by Anna Wild Matthews, that insurers are changing how they pay for cancer care. WellPoint, which is a very big insurance company, the article says, will begin offering oncologists $350 a month for each patient who's on one of the insurance company's recommended treatments. So that rather than the doctor providing the recommended treatment and the patient accepting that, the insurance company wants to provide extra money that they make the recommendations. And Brian Bauworth, the chairman of Cleveland Clinic, said, well, where it makes sense and the extra $350 payment is not something we'd ignore. So, in fact, he's citing for $350, they would look at that and take that into account for how they make recommendations. He also said, we generally don't like to practice by insurance company. We practice by patient. But on the other hand, he's saying that where it makes sense, they're going to take the $350 each month from the insurance company. So the insurance company chooses how patients are treated. Is that what you want? I don't think so. I think you want to go to the physician that you trust, the physician who comes up with the best regimen for you and the best options for you, and then you ask questions in an honest way without a $350 per month fee. You get the best treatment for you. And also in this article, they say that cancer treatment in hospitals now cost 189% more than in private offices like our office. So you can see how hard it is to fight the big boys when they're getting money from the insurance companies, they're getting money, higher payment from the government for care. So when you get care, you may want to ask how it's coming and why it's coming and what to do about it with your doctor. And are there any secret hands there? We have a caller. You're on the radio. This is Dr. Lederman. Good evening.
Hi, is this the doctor number?
This is Dr. Lederman. You're on the radio. What's your question tonight?
I want to know. I heard you said something about a man who had a pain in his back.
Mm-hmm.
And if you find it, I think I'm going through the same problem.
Well, just give us a call. Call this number during the week, Monday through Friday. We'll make an appointment and fit you in, okay?
Hello?
Just call us at 212-CHOICES, the same phone number, 212-246-4237, and we'll see that you're taken care of, okay? Thank you. Okay, we're getting close to the end of the hour, unfortunately. Remember, we have 5 radio shows, unique radio shows every weekend. The first is on WABC at 5 till 6 a.m. Saturday morning. And then we have 4 shows on WOR at 1:30 in the morning, Sunday morning, at 3 till 4 a.m. Sunday morning, at 5 to 6, at 6 till 7 on WOR Sunday morning, and then this show from 9 to 10. So we're trying to provide a lot of information to you. If you have other questions, please call us at 212-CHOICES during the week. We have free information booklet and DVD that we will send out to you, and we have that new prostate booklet with new data, which we'd be happy to provide. We're a private cancer treatment center, which means you're the boss, not the drug companies. We have innovative technologies. We were the first to provide radiosurgery in America for cancers in the body. We have hyperthermia, which is a way of heating cancers, and in certain cases, hyperthermia along with radiation helps kill the cancer. So we're not only super convenient, we're at 38th and Broadway, which is close to Times Square and Herald Square, Penn Station, Grand Central, Port Authority, but most subways, trains, and buses. Most all our care is outpatient, so you come in. If you need treatment, get treatment, and go home or go back to work. So we're happy to answer your questions. Again, these are questions people commonly call and ask about. My name is Dr. Lederman. Our facility is called Radiosurgery New York. It's at 1484 Broadway and 38th Street. We're located between Macy's and Times Square on Broadway. We have a spacious, modern cancer treatment center, and we're devoted to taking care of patients with cancer, to provide the most innovative treatment possible, to keep you out of the hospital whenever possible, and to give you the answers and the options that we think you deserve. So we think you do deserve the most chances and do deserve the most choices, and even our phone number is 212-CHOICES. So we accept most insurances, Medicare, Medicaid, and the goal is to provide information and care to you for patients and their families with cancer. Again, this is Dr. Lederman. Thank you for listening. We'll see you next Saturday morning on WABC at 5 in the morning. Till then, call us at 212-CHOICES, and have a great week. God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas